My name is Dr. Clara Wekesa. I'm a PhD fellow with Thrive. The area of my research interest is liver disease in HIV. Uganda is 2 decades into ART therapy, and we find that our patients are now living to normal life expectancy. And as a result, they are less prone to death from opportunistic infections as before. And now we find that there are new conditions that are accounting for death and disease in this population, one of which is liver disease, which is the second leading cause of death in this population. Sub-Saharan Africa alone bears 80% of all HIV-infected patients, and so this is relevant to us. A lot of studies done, especially in the Western populations, have shown that HIV accelerates the progression of liver disease. Our own study setting has limited information on this and therefore forms the basis for my research. I intend to assess for liver fibrosis non-invasively using FibroScan technology. Now, FibroScan technology works just more or less like an ultrasound scan to ascertain presence of liver fibrosis or the absence thereof. In this era of changing risk factors, it would also be important for us to understand what factors now play a major role in the development of HIV and AIDS in our patients. This is important for us, one, as a country, to understand the burden of liver disease. And also, by understanding what risk factors drive this burden, we'll be able to fashion interventions and choose key populations in which we'd like to administer prevention measures. In as much as we are using the FibroScan technology in this study, we do appreciate that it is still a very expensive piece of equipment that cannot be readily disseminated, and therefore it is limited only to research settings presently. We shall be assessing for the use of serum biomarkers, and these serum biomarkers are really derived from readily available, inexpensive and routine tests that are done from patients. And this would help for screening purposes, even for medical personnel who are within hard-to-reach areas, and provide some kind of algorithm for referral of patients for further liver care and management. I am grateful to Thrive for the emphasis on policy engagement. This opportunity enabled me interface with the technical working group in the Ministry of Health of Uganda, where I was able to present preliminary findings of my work, presenting on burden of liver fibrosis both in rural and urban Uganda, and what factors we found associated at the time. And I intend to build on this further in terms of advocacy following the results of my study.